This time, relax with the real ginger taste of Canada Dry.
Listen to AM 560, The Answer, online at 560theanswer.com, on the AM 560 mobile app, and your Alexa-powered smart speaker, on TuneIn, iHeart, and radio.com.
7:07 Team Hochberg Traffic Center time, and Jim Telemonti.
The northbound tri-state is jammed. Southwest Highway to 75th Street with a stall on the shoulder. Reagan Tollway westbound before 31. Watch out for a crash in the left lane. Inbound Kennedy is heavy. Looking at 45 minutes O'Hare to downtown. 23 from Montrose, 24 the Express. Outbound 31 minutes to the airport. Eden, 20 minutes like Cook Junction. Eisenhower, crash at 25th to the right lane. 45 minutes, 390 to downtown. Stevenson is 51 minutes, 355 to Lakeshore Drive. Ryan, 25 minutes from 95th. I-57, 25 minutes, I-80 to Merge. Bishopford, 20 minutes from 8094 to the Ryan. Lakeshore Drive still looks okay. That's traffic. I'm Jim Telemonti on AM 560 The Answer.
Chicago's Morning Answer continues next. Your official Chicagoland weather forecast. From the 1-hour heating and air conditioning weather center, clouds and sunshine today, windy and chilly, a high of 32. Currently 25. Next news at 7:30. Chicago's Morning Answer with Dan and Amy continues next on AM 560, The Answer.
This hourly segment is brought to you by Get Down to Business with Shalom Klein, the show for business and jobs powered by Tandem HR. Heard Sunday evenings at 6.
This is Chicago's Morning Answer with Dan Proft and Amy Jacobson on AM 560, The Answer.
We'll hear from the principal of this 40-year-old business in Schaumburg.
It's 41 years.
41
He just celebrated
old.
the 41st anniversary.
Happy birthday. Boy, you must remember your 41st birthday from, a couple of decades ago. Seems like just yesterday,
I see that you
it?
gave me an application for the elderly bachelor.
Yeah.
Thank you.
Well, only because I know Edward James Olmos has already signed up.
Oh, that's so bad.
We'll talk to RM
He's the
Services, Lou. That's all his name goes with, just Lou.
Lou.
Everybody knows him as Lou at the bottom of the hour, but we have to address the coronavirus at the top of the hour now, as President Trump did yesterday, trying to provide some context to the threat level.
Because of all we've done, the risk to the American people remains very low. And we have the greatest experts in the world, really in the world, right here. The people that are called upon by other countries when things like this happen. We're ready to adapt, and we're ready to do whatever we have to as the disease spreads, if it spreads.
And prior to introducing Vice President Mike Pence as his point man for the coordinated response, President Trump recounted what has been done by the administration and what is being done.
We've stopped non-U.S. citizens from coming into America from China. That was done very early on. We're screening people, and we have been at a very high level, screening people coming into the country from infected areas. We have in quarantine those infected and those at risk. We have a lot of great quarantine facilities. We're rapidly developing a vaccine, and they can speak to you. The professionals can speak to you about that. The vaccine is coming along well, and in speaking to the doctors, we think this is something that we can develop fairly rapidly, a vaccine for the future, and coordinate with the support of our partners. We have great relationships with all of the countries that we're talking about. Some it's a fairly large number of countries. Some it's one person, and many countries have no problem whatsoever. And we'll see what happens. But we're very, very ready for this, for anything, whether it's going to be a breakout of larger proportions or whether or not we're at that very low level.
Dr. Anthony Fauci also addressed, per Trump mentioning vaccine, he, from the National Institute for Health, addressed the time horizon for a vaccine. And this is important because there's been some sort of partial reporting on this. And it's not 6 weeks. That's, sort of a first stage trial. What you're really talking about for any sort of vaccine is a year to a year and a half. He went through that process in some detail, which was very helpful to inform the public. He also, though, made mention and distinguished between a vaccine and antiviral therapies, like the antiviral therapies we have for the flu, which we're more familiar with in this country, and that there's more promise for potentially antiviral therapies that could effectively treat coronavirus in a couple of months versus a vaccine that may be a year and a half away. For more on this topic from the medical perspective, we're pleased to be joined by Dr. Roger Klein, who is a former director of molecular oncology at the Cleveland Clinic, former advisor to the FDA, CDC, CMS, HHS, all the alphabet soup bureaucracies. Dr. Klein, thanks so much for joining us. Appreciate it.
Yeah, hi, Dan, Amy. Thank you for having me.
What was your assessment of everything you heard from the politicians yesterday? Yes, but even more importantly, the healthcare professionals that know what they're talking about.
Well, I'll comment on, since you played the president's tape. I've been doing a lot of radio shows, and he said pretty much what I said. So I was actually reassured to hear the president's sober and what I view as realistic and appropriate comments. You look at this and we've already got a lot of numbers here. Some of them are coming out of China, and there's limited reliability. But we've had a chance to observe patients. We know that there's a little over 80,000 cases have been documented in the world. There's probably significantly more, for example, in China than have been reported. And what's happening is the sicker people are tending to get tested, and so the virus is looking more dangerous than it probably is. I mean, if you look at, for example, the death rate in China, which you've got to believe would be higher than here, in my view, because of the care system that we have. If there are 5 times more cases in Wuhan, China, you have a death rate that's 0.0, less like 0.6. You're getting into low ranges, resembling the flu. I think so. And people fear the spread, and I think that's rightfully so. But look at we have 40 million people a year infected by the flu here. 40 million, 60,000 deaths. We're not approaching that. We've only had 15 people who we've tested here or 14 people, depending on who you're looking at, that have tested positive based after coming here. With a total after bringing in people, a total of maybe 60 or so people here. So 270 people a year get struck by lightning, and right now I think we're in pretty good shape.
Well, what scares me about this, a lot scares me about this, but President Trump, saying that we're doing screenings that are necessary, but you could have the coronavirus, and correct me if I'm wrong, without having any of the symptoms, and you can be spreading it to other people.
Yeah, that's true. And
Does that concern you?
I don't think it doesn't. It doesn't. I mean, on the one hand, yes, because more people will get it, but that's true of the flu. On the other hand, it suggests that we have a reported seriousness of cases of, say, 80%, but that's probably much lower. I mean, if there are a lot of people walking around who don't have symptoms, what it means is the virus is less threatening and less serious and less deadly from the standpoint of an individual infection, although it could suggest that more people will be infected and therefore cause greater harm. But I think in some respects, it cuts both ways.
I wanted to just get your reaction to some of the responses from infectious disease experts, medical professionals. Dr. Marguerite Neal at Brown University, my mantra, keep calm and carry on. Dr. Stanley Perlman at University of Iowa, coronavirus expert as well. If you see someone on a bus who is coughing, move away. Neil also saying, don't wait until the last minute to refill your prescriptions. You want to comfortably have at least a 30-day supply. It seems frankly, very pedestrian advice we're getting from the medical professionals. Is this to tamp down hysteria, or is it also just a recognition? Wash your hands, don't cough on people, cover your mouth when you sneeze, do all the things that you would do otherwise in polite society, and just keep your head about you.
Well, right now, the greatest threat, and it's just it's many, many, many times more is the flu. So and people get colds too. So of course you should do these things because you don't want to get the flu. And if you're in contact with elderly people, or you have some underlying illnesses, you absolutely must get a flu shot. And everybody should get a flu shot. And you should get one now. The flu is a tremendous threat, and that's what I think where people are not placing. I don't think people are placing this in context because they're not looking at what the flu does every year. And
well, right, and the reason that.
And
the reason we're not, I mean, if we're just understanding human behavior and the media is because we're covering this every moment of the day. If we covered the 40 million people who were infected, who had got the flu, the 16 to 41,000 people, according to CDC, that have died this season from the flu, if we covered every one of those deaths, every time somebody got sick, people would be running around like chickens without necks about the flu.
We're covering this because China's on lockdown, and they have been for a month, and all of our goods are there, and we're not going to get them anytime soon.
And that is not why we're covering it. And so if we were covering 16 to 41,000 deaths in over a 4-month period from the flu, like we're covering coronavirus, then you would have people like my co-host here wearing latex gloves and masks around and completely overreacting to the size of the threat.
I think look. And in all deference, Amy, I think we need to step back and look at this. There are many, many greater risks in society, like driving a car right now, than there are from dying from this flu-like illness. And I think it is resembling more. It's looking more like the flu. Look, we had a ship, Diamond Princess. They took people and they quarantined them. But probably the worst possible thing you could do, take people and put them in this small. I'm sorry.
No, you're right. No, go on. I'm agreeing with you because this air kept circulating through the whole ship and got everyone infected.
Right, and no, it didn't. It got about 20% infected. So what I'm saying is, you have a population density extremely tight. Worst thing you could do would be to take these people and put them all in a small space, and you're getting 20%. 5 to 20% of Americans get the flu each year. And the point is, look at Wuhan, China. They have 11 million people in that city. Fewer than 1% of the population has been infected. There are areas where they're very, very tightly packed. So taking people and shoving them into small spaces where they're coughing and sneezing on all sorts of counters and rails and near one another and shedding droplets is not going to prevent spread. It's going to encourage it. You'd be better off out in the country where you're not on top of each other.
Oh, don't give me the idea. I'm moving to the country. But what is this idea? I mean, some people that have it, though, and you see them on Skype and they're talking and they look completely fine, yet they've been diagnosed with a coronavirus.
Yeah, I mean, it makes sense. But I think that's a good thing, not a bad thing. Because if it were Ebola, where the president made that point. If it were Ebola, where everybody who was getting it was dying, we should be horrified. But if most people who get it don't even show symptoms, then or have very mild cases, we're looking at something that appears to be very similar to a flu-like illness. It doesn't seem to be behaving that differently. And look, the flu kills a lot of people. I don't want to underestimate it, and I don't want to not. We need to take this seriously. We need to be monitoring. We should actually be testing more people, in my view. And that's a regulatory issue. We're not distributing the testing fast enough. But I think we need to look at it more like the flu and less like some catastrophic plague that is an existential threat to human society, which is what the impression you could come away in, that the sky's falling down.
Yes, familiar with that impression. With respect to the testing, Scott Gottlieb, former FDA director under Trump, made this point that you're, I think, referencing. He talked about bottlenecks at CDC and FDA with respect to the diagnostic tests for coronavirus, and that there should be green lighting of laboratory-developed tests at the local hospital level. It shouldn't all be run through the centralized bureaucracy of the CDC, because the turnaround times are going to become too long if we get a serious increase in the number of cases. Is that something you agree with?
Yeah, I'm a pathologist, and I do that testing. I do that type of testing, and most tests in many areas are laboratory developed. But it's not only laboratory developed tests. I mean, yes, I think we need to have a mechanism whereby laboratories can bring highly skilled, qualified laboratories and with very, very smart people running them in academic medical centers and other large hospitals. Are bringing these tests up, but there's also a company that's already got a test CE marked and selling available in Europe, a U.S. company. So you've got a company. I saw a press release 2 days ago from a company in Utah. They're CE marked in Europe. They can sell that test in Europe, but they can't sell it here.
Okay,
and I know I talked to people. I have talked to people who are directing labs who would set up testing now at large labs in major cities, but where they would set it up, but they don't have the ability to do it.
And they don't have the ability because this is an FDA block, or why can't
yeah.
they?
Yeah, they're not allowed.
FDA block.
So I mean,
right.
People don't want to start getting warning letters and because have FDA coming in, and what they're doing is they're saying the CDC is not allowed to distribute its tests, which would be another way to do laboratory developed tests, is to distribute them to, for example, major hospitals in major, in major cities. You could do more surveillance that way and test more people. Again, there's also a kit. I mean, I haven't looked at the kit. I haven't seen the reliability of the kit. What I've seen is that it was announced in media, and you can look it up yourself, that there is a test kit available. I think the company's named Co-Diagnostics, and I don't know anything about them. I'm not related to them. I can't verify the test. What I can say is that CE marked in Europe. They had a press release, and they're allowed to sell it in Europe. It's in Utah. It's based in Utah.
I want to get your reaction to the argument about funding to $2.5 billion, $4 billion, $8 billion. The argument among the politicians in D.C. about that. What is the importance you place on the difference in the proposed funding levels for enhanced coronavirus preparedness?
Yeah, so in my view, this is a political discussion, not a real one. And I think what's important is that we mobilize the people and the resources that we have. We spend a lot of money on this already. We have a lot of very highly trained, qualified people in many, many contexts. We have top world-class medical centers in most major cities, if not all. We have a lot of people engaged in this effort, and I think I have to rely on Secretary Azar and President Trump. He's presumably getting the information about what's needed from the professionals who are directly working with this. And Alex Azar, Secretary Azar, is an extremely capable person, and they've got a lot of very good people. Everybody would like to have a bigger budget. But we also spend billions of dollars already in this area, and we have state health departments across the country. Some better funded, some less well funded. But I think we're doing the right thing. I think thus far the administration has done exactly what it should do. They were criticized early on for travel restrictions and that sort of thing, it's worked. And I think it's a political discussion, and we need to make this not a political discussion. We need to try to analyze this and look at it not with criticism, not trying to pick points and trying to play November's election off of this coronavirus, but to address it in a way that's most beneficial for the United States public.
He is Dr. Roger Klein. He's an expert with the Regulatory Transparency Project's FDA and Health Working Group, former director of molecular oncology at the Cleveland Clinic, and former advisor to the FDA, CDC, CMS, and HHS. Dr. Klein, thank you so much for joining us. Appreciate your expertise.
Yeah, thank you very much for having me.
Thank you. And he joined us on our turnkey.pro answer line.
You're listening to Chicago's Morning Answer with Dan Proft and Amy Jacobson on AM 560. The Answer.
The average commute in America is about 25 minutes. And if you spend more of that time on a train, bus,
next stop, Lake Street,
or bike, Allstate has good news. Pay per mile car insurance is here.
on your left.
Because if you drive less, you should pay less. Now get the same reliable coverage and hands-on expertise you'd expect from Allstate, but at a price that's tailored to the miles you drive.
The doors are now closing.
Call your local Allstate agent and start paying what's right for you. Prices daily and per mile rate, subject to terms, conditions, and availability.
Happening across the nation right now. ADP is helping Party City stores streamline recruiting. Music houses like Squeaky Clean Studios are demoing tracks while ADP helps keep business on track. And ADP helps a small Mexican restaurant keep up with compliance demands. When ADP helps businesses achieve what they're working for, that's newsworthy. HR talent, time, benefits, and payroll. Informed by data and designed for people. Learn more at design.adp.com.
Hey, if you've thought about taking advantage of those 2-for-1 offer on the MyPillow Giza cotton sheets, I suggest you do it today.